Welcome back, you beautiful people. You are with your feel-good breakfast show. It is Expresso, live on SABC3. Now, of course, it is Freedom Day and it's a public holiday, but of course, we're sitting at home during lockdown. The reason for that is that everywhere you turn, radios, TV, social media feeds, they're all dominated with COVID-19 related stories. And many of us, even though we're seeing and hearing these stories all over the place, we're still very confused about some aspects of the disease. Now, Dr. Mathobela Matjekane from CliniMed joins us via video call this morning to answer a few burning questions on the coronavirus. Dr. Matjekane, good morning.
Good morning. How are you?
I'm absolutely fantastic. Better seeing your face this morning. You look stunning. But of course, Doctor, you know, the most important question right now, I think, for a lot of people is, what happens if I start feeling sick during lockdown with sickness unrelated to COVID-19? It's very easy to think that it might be related, but what happens then? What do I need to do?
When you get sick due to an illness that is not related to COVID-19, you can still access your general practitioner who would be able to assist you in that regard. So we're still open, doctors are still working because we are part of the essential services. So people that are still sick with their chronic condition, they can still go and see their doctors. Even anything that you might be sick with, headaches, whatever, you are still able to go and access your doctor.
This is fantastic. So thank you so much. We take our hats off to all of you working and putting yourselves out there and working during this time as essential services. But we know that there has been, news reports of the fact that there is shortage of testing kits across the country, both in the private and public sectors, which means not everyone is eligible to do COVID-19 testing. Is this correct? And what would make someone a candidate for COVID-19 testing? Where should they go?
Firstly, people that are currently getting tested, we are testing mainly based on their clinical symptoms, which would be a fever, which is a temperature of above 37, a cough, a very dry cough that is not going away, shortness of breath, as well as sometimes people can experience nausea and vomiting, and headaches, generalized body pains. If anybody has got those signs, those are the people that we will consider testing, as well as more likely also if they have a contact of COVID-19. And that means if they've been in contact, who was in contact with a person that has tested positive for COVID-19.
Well, Doctor, we know that COVID-19 is certainly very, very serious, and someone testing would want to make sure that they get their results and the outcome of those results as soon as possible. But how long would it take, on average, for someone to get their results back?
When the whole pandemic broke in South Africa, it was taking us anything between 72 hours to 48 hours. But currently, due to the reduction in the agency, we're seeing anything between 24 hours to 48 hours. And I must say, it depends on which lab your specimen is taken. Most of the private laboratories, it would take you anything between 24 hours to 48 hours to get your results. In the public sector, it might take a little bit longer, but as soon as the results are available, there are mechanisms that have been put in place to try and trace the people that have tested positive, to make sure that they are following proper protocols in terms of quarantine and everything.
Well, the bottom line, Doctor, is that everyone is working hard, both in the private and the public sector, to make sure that they get those results out. Everybody really does put the patient's care and health right at the front. But let's talk about pregnant women. It can be quite stressful during this time, and it must be stressful. If you are pregnant, can women with COVID-19 pass the virus to their fetuses or their newborn?
Due to the fact that this pandemic or this virus has been around for not so long, there hasn't been much data to say that COVID-19 could be passed to the fetus. However, they must still practice precautionary measures when it comes to their condition as pregnancy. Most of the times, people, when they are pregnant, their immune system tends to be lowered a bit, which means they are more susceptible to getting other infections. So there hasn't been much data to say that when you are pregnant, you are going to pass the infection to to your baby in utero. However, it's very, very important to still practice all the protocols that are out there pertaining to reducing the infection to either yourself and the people around you.
Okay, so let's talk about being intimate. Being intimate during the coronavirus pandemic, and I almost said being intimate during the lockdown, but both could work. What do people need to know about being intimate during this time?
The way coronavirus spreads is mainly via air droplets, meaning when you're coughing or sneezing and then the droplets land on the surface, somebody else touches the surfaces and then they touch either their eyes, nose, or mouth. So when it comes to intimacy, what is important is that you must still practice safe hygiene methods like washing your hands and everything. There's no data that says that it's a sexually transmitted disease like diseases like HIV and all that. But if the partners are not taking precautionary measures and they're exposing themselves to the virus, yes, they are more likely to get infection via maybe kissing and stuff like that. So you can get it because of the closeness between the two people rather than the way HIV gets spread via intercourse, yes.
Dr. Mathobela, thank you so much for your time. I can hear your phone vibrating in the background there. You are a busy woman with lives to save and a whole lot of people to touch during this time, well, to help and save during this time. Thank you so much for your time. I know that you are working so hard and so tirelessly, and a lot of you, other healthcare workers out there, we do salute you for all of your efforts.
Thank you.